So I just want to touch base upon this patient referral thing. My questions to you, Guruji sir, is it the right decision to refer when we think that patient will be better handled in a higher center? How to write the referral letter? What are the points to cover? What are the common mistakes that we generally do to avoid it? And is it a matter of shame that we are not able to handle the patient and we are referring? And what to tell to the patient while we are referring? Can you please elaborate on this point?
See, it's a very important thing. If in a right time, if a patient is referred to a right place or a higher center, definitely the person will survive. The patient will survive. So we need to assess and understand whom to refer, where to refer. We should not feel shy or shameful while referring. It is not a matter of shame. It is a right kind of decision that you are referring the patient to a higher center because he needs or she needs a better management or institutional care or something like that as a higher center where they are handled such cases on a periodically on a daily basis. So when such a matter is there, then we need to send to the those type of things. So usually we send refer the patient only two things. We send the patient if the patient requires such type of treatment, which can be handled or done at the higher centers or institutional care for that purposes. Second thing, we will refer the patient to a doctor of particular nature because he has handled such type of cases previously and we know that yes he is handling those type of cases and he can handle them better manner. So in those two conditions we usually refer the patient to higher centers or better doctors. Second thing, while referring the patient, what we are supposed to write, just refer. While writing, basic information has to be there, like patient name, age, and so, suffering from what the initially what we have understood or identified in the patient is suffering from so and so condition. He requires a special care or emergency basis management. That's why I am referring the patient for you for the further management and your opinion. So like even like that we have to write. It's a simple methodology of writing it. We don't want to even write all the information whatever we have lengthy postcard. It is not required. Simple, what the patient name, age, and what you suspect that he is suffering from. With that reference, and why you are forwarding it and referring it. That can be very right kind of referring a patient to the higher center. Then mistakes. Many times when we write referring letters, in that we will also try to give out our findings. Sometimes that findings may be a wrong finding or maybe sometimes we write some diagnosis. That diagnosis may also be wrong. Then that's what we are supposed to write there. There is this person so and so XYZ is aged about so and so, is suffering from this things, and I suspect a probable diagnosis of particular disease name. Then that's why I'm sending this person to you, referring this patient to you for better management and higher your opinion and better management. So like that, if you send the patient to a higher center, that will be wonderful.
And especially when the patient's life is at stake, that say you are suspecting a case of ischemia or ongoing heart attack and all. So rather than just speculating on your own and trying your own remedies, because higher center care is very much required there, and along with that, some investigations are to be done to find out really what is happening. So they're better to refer, and in a bigger hospital, they'll be having both the diagnosis part and the surgeons and other cardiologists will be there. So sometimes these referrals can be life saving. So we should be open to refer. So.
Definitely, we should be open to refer. We should not feel shamed while referring because many times Ayurveda very clearly said, Vaidya Samuha Nissam Shekarana. There will be Vaidya Samuha. People, there will be 4 doctors, 7 doctors, a team will be attending on the case. So if you refer to that, then there will be people to take care of the things. So we should not feel ashamed or something like that while referring. Referring is an art. Referring the patient in the right time may even save his life. So we need to be very clear in these things. Referring It should not be any, we should not feel bad or something like that, that I am unable to diagnose or I am unable to treat this condition. Why should I refer? And what is this? No such issues. First and most primary importance for a physician is to sustain the life of a patient. That is a very important. If life is at risk, we should be very fast and free in action. I should be swift in action, and so that the patient life is sustained or survived.
And sometimes we Ayurveda practitioners may get into trouble because we did not refer a case in the right time. Something may go wrong and a patient may go into cardiac arrest. And I remember, as my memory is serving, you only told this one that patient came and his ECG was getting taken, and the patient was from village side, and ECG was coming and suddenly it stopped. So patient died while the ECG was taking, and the patient's relatives, caretakers, they started thinking that probably the patient died because of some current was given to the heart, and that's your mistake. These kind of serious complications or unexpected situations are better handled in a big institution rather than a rookie Ayurveda doctor sitting in a small clinic.
Definitely. See, in our clinics, we will be having handled by single doctor clinics. So, single doctor clinic will always be having some pressures which cannot be handling these type of things. So, better these type of things should be referred to higher center where there is a group of doctors are there. They can handle it very better manner.